job role?
My name is Lewis Jones and I am an emergency medical technician with the Welsh Ambulance Service.
Where do you work usually?
I work at a Cumbulla station, which is in Swansea Central.
How many calls would you say on average you get a shift, or does it vary?
In Swansea, it's kind of short, sharp to hospital, so normally between about 5 and 7 jobs a shift.
Do you tend to get a lot of drunk calls from Swansea?
Yes.
How many would you say you'd have on a random shift or a busy holiday or something?
Probably the weekend is more, Friday, Saturday, Sunday nights, but now with uni time, a lot of the uni nights are Mondays and Wednesdays, so pretty much throughout the week now is constant.
How do you feel about the drinking culture in Swansea, especially with students and, like you said, Wednesday nights?
I think Swansea's probably ranked as one of the highest for binge drinking. So we've got Wine Street with a strip of bars down there, so I think it's quite common. And there's quite a lot of students in coming to Swansea University these days, a lot more student accommodation. So I think it is quite rife, as Swansea is ranked highest for alcohol and drug abuse.
Has there ever been a time where you've answered a call to someone that's intoxicated and then another patient suffered because they've been made a priority over that?
Yeah, so the problem with drunk calls, especially if they're outside in a public place, they can come in as red calls, which is the highest priority, because the call on the phone will state that the patient is unconscious when they've just passed out drunk. So these will take priority over all other calls. So then this would take an emergency ambulance, normally 2 emergency ambulances, away from other jobs that are outstanding. So I'll have a detrimental effect then to all the other calls that are waiting, which actually need us.
Do you find that quite frustrating then?
Yeah, very frustrating, but from our point of view as a road staff, we can't do anything about it. We just got to go to the calls we get given by our control.
Are there a lot of queues outside hospitals for beds? Because there's a lot of coverage in the media about that. Do you find that's quite rife in Swansea?
Yeah, massively. Morriston is the only A&E in Swansea at the moment. So all areas down to the Gower, all Swansea up until Port Talbot, Bridgend, a lot of them will come to Morriston because that's the major trauma hospital, and stuff like burns and plastics. So they will take pretty much everything, so that's why it's so busy. And a normal day will be queues outside, 3-4 hours is normal, especially in the winter months. It's not uncommon to have full shifts queued outside A&E.
Do you think the issue could be avoided? Like the stress upon the ambulance service and the hospitals, GPs, things like that?
In terms of drunk calls,
Yeah.
intoxicated calls, yeah, I think members of the public just need better educating on what constitutes an emergency. I know a lot of, especially students don't want to deal with their drunken friends or intoxicated friends, so they just think calling an ambulance is an easy way out.
Is there a time that's happened to you specifically?
Yeah, I can recall a job that I went to in Swansea. We got called by I think the caller was a 21-year-old female who called us because her boyfriend came home to her intoxicated after being on a night out in Wine Street. So she obviously wasn't happy, frustrated with him, and for some reason has called 999 for an ambulance. Thankfully, our ambulance staff deemed it as not immediately life-threatening, but it was still deemed as an emergency call. So this call was waiting for about 3 or 4 hours before we arrived. So by that time, the patient was actually sleeping. We were taken to him by his girlfriend, so we then had to wake him up. And by that point, he was quite sober. He had full capacity, so there was no need for us to convey to A&E. So we basically just had a quick chat with his girlfriend as to why she's called us. She stated he was a lot worse a couple of hours ago, but we did it after our full set of observations. And like I said, he had full mental capacity, so he was safe to stay with her as she was a responsible adult as well, because she hadn't been drinking. Whereas if she had been drinking as well, we'd have to take him to A&E and he'd take up a bed. Because when patients are intoxicated, like if they're with all their friends that are intoxicated as well, as ambulance staff, they won't be deemed as having mental capacity if they're heavily intoxicated, so we have to take them to a place of safety, and the only place for that is A&E.
Do you think these sort of things could be avoided if the general public were better educated on how you do deal with situations like that?
Yeah, definitely. And they do have help points set up now on more Saturday evenings. So the help point is run by a team of nurses, paramedics, and sometimes doctors, to avoid ambulances going down to like Wine Street. So they'll take the intoxicated patients to those, and they can be treated in there, where they can set up fluids and monitor them there. Because a couple of years back there'd be 5 or 6 ambulances down Wine Street every Friday, Saturday, Sunday night. So that's helped massively. But they don't set up the help point on Fridays, it's only Saturdays. They'll only set it up on Fridays if they've got a specific event on, where they'll bring more people in. Although it's great for Saturdays, it doesn't stop the Mondays, Wednesdays, student nights, and the Fridays and the Sundays, which we still get a heavy amount of calls there.
I suppose with all the ambulances down on Wine Street on days like this, the drain on resources, how much is it roughly for an ambulance to be called in your services?
I think it costs around £400 just for an ambulance to get called out. So it is, a massive strain on the NHS. A lot of these calls are, not needed. So where an ambulance will go out, the patient can be treated on scene and left there. So it is quite a waste.